The new year has brought old challenges to hospitals across the region. Healthcare sites in Hamilton and Niagara are reporting high wait times in emergency departments, continuing to grapple with capacity issues and staffing shortages. Maria Saru has that story.
Bhumika Gogia tells us she arrived at a Toronto emergency room in December, unconscious and bloodied with a fractured nose.
I feel on ice on my face.
Gogia says she required immediate care, but after lying on a stretcher for half an hour with no help, she left.
I was informed that it will take a lot of time for the doctor to see me, like 4 to 5 hours. I was bleeding and the bleeding was clearly visible.
She says days later, a specialist in Brantford pushed her bone into place, telling her getting treated earlier would have been better.
That pain was terrible. It was very terrible. What if it was a major accident?
ER wait times across our area have already jumped this year. A spokesperson for Niagara Health says wait times have increased by nearly 2 hours in 2024, adding, on several occasions in recent weeks, we've seen a record-breaking 600-plus patients a day visiting our 3 EDs. That's compared to an average of closer to 415. As of 4:30 p.m. this afternoon, the wait in St. Catharines and Niagara Falls was 4 hours and 3.5 hours in Welland. In Hamilton, a spokesperson for St. Joe's says hospital occupancy is at or above capacity, with a record 240 patients seeking care on Monday. And Hamilton Health Sciences is also experiencing high patient volumes in emergency departments. NDP leader Marit Stiles urged the Ford government to adopt 3 solutions at Queen's Park today. The first being to drop its appeal of Bill 124, which capped salary increases for public sector workers to 1% for 3 years.
It's devastated frontline healthcare. It's showed them deep disrespect, and it is a major factor in what is driving them out of our hospitals.
The call was echoed by ER doctor and Liberal Don Valley East MPP Adil Shamji, who was also at Queen's Park this morning, separately sounding the alarm about healthcare.
For as long as the Ford government is trying to suppress wages and actively disrespecting healthcare workers, we will have a major healthcare worker retention problem.
In Waterdown, more people are telling me about their recent experiences with the healthcare system that left them feeling dissatisfied.
I have a cyst that needs to be removed, and I've waited now 6 months to get an appointment.
It was my mom that I brought into the hospital that day, and it was rough. The hospital let her sit there for about 5 to 6 hours.
I think we need more money given to healthcare people, the nurses, because it seems like that's where the shortage is.
When reached for comment, the Ministry of Health did not respond by deadline. Maria Saru, CHCH News.